This is the American Health Care Act. It's been a long time in coming. This bill, the American Health Care Act, it keeps our promise to repeal and replace Obamacare. It delivers relief to Americans fed up with skyrocketing premiums and fewer choices. It moves us away from the broken status quo toward a better, patient-centered system. That means lower costs for hardworking families. It means more choices and competition so that you can buy the plan that you need and that you can afford. It means greater control of your health care. As you know, this is the culmination of years long of an inclusive process that we've been doing here for years. Last June, as part of our Better Way agenda, we put forward our vision for health care. After the election, we began to work with our counterparts in the Senate and with the Trump administration on this plan. I want to thank President Trump. I want to thank Vice President Pence, and I want to thank Secretary Price for their support and their hard work in getting us to this repeal and replace point. I also want to thank Chairman Brady, who's going to be joining us in a minute, and Chairman Walden for their leadership. Now this bill will go through the regular order process in the House. As it does, I encourage all Americans to read this bill online at readthebill.gop. Go online and read the bill at readthebill.gop. Doing big things is never easy, but we have made a promise, and we're going to keep that promise. We made a promise to repeal and replace Obamacare with conservative solutions and reforms. That is exactly what this bill does, and that's why we're here. Thank you.
Well, I do want to echo a couple things that the Speaker said. I do want to thank the President. I do want to thank the Vice President. I do want to thank our new Secretary, Tom Price, as well. If I just listened to the President meeting with the Deputy Whip team, he said he was proud to support this new bill. Why? Because of the years of work that has gone into it. We know why we are here today. Because Obamacare did three essential points. One, it created an exchange. Well, we all know the history of what's happened to that. The failures, the companies pulling out. And now you have 1/3 of the entire country, 1,022 counties, with one only health care provider. They created 23 co-ops, provided more than $2 billion. 18 of those co-ops have collapsed. It expanded Medicaid. Well, we know it can't sustain itself. So we have to put Medicaid on being able to sustain itself, and that's why I want to thank Chairman Greg Walden for the work that they're going through as well. And third, it made government control health care, the regulations that it imposed upon everybody else. Well, today is a new day, and we stand proud with our President that he supports this bill to move forward, to keep the promise that we made that we would repeal Obamacare and replace it, to put the power back with the individuals.
Well, good afternoon. I want to thank my colleagues for their work on this, especially the President, the Vice President, Secretary Price, Mr. Brady, and the members of our Energy and Commerce Committee, especially our subcommittee chairman, Dr. Burgess, who have put in incredible amounts of time and work. As you know, this bill went public last night about this time. It's available online for everyone to see, and this is the conservative alternative to Obamacare. This is how we're going to reform health care in America and give choice back to people, rescue the failing individual market. We're proud of this piece of legislation. We look forward to marking it up tomorrow. Remember, we made a promise to the American people that we're going to keep it right here, right now, by repealing Obamacare and replacing it with something that will work for them. But remember, this is just the first step. This is just the first step. This legislation begins the process of transforming the health insurance market. It also amounts to the biggest entitlement reform since Bill Clinton signed welfare reform into law, because we're going to restore to the states authority that's been taken away from them, make them have to not come here to Washington and ask some bureaucrat for permission to do everything, and instead allow them to innovate, to be creative, to get their hands around patients who need their help the most, and to best use those dollars. And with Medicaid, it amounts to a per capita allotment. So they'll know what they can expect. It works for them. We've worked closely with the governors. So tomorrow at 11 or 10:30, we'll kick off our markup. We'll begin this process in an open and transparent way. But let me say again, Look, we're going to make sure that those who have pre-existing conditions continue to get health care and health insurance. We're going to make sure that there are no lifetime caps, and we're not going to kick your kids off their plans until after they turn 26. We'll help you kick them out of the basement, maybe, but not off their health insurance. This is important work we're doing. We look forward to moving forward on it and to providing the rescue for the individual market and relief to the states and help to the people that sent us here to get this job done.
Well, I think Mr. Brady's still at the White House, so we'll just, we were going to have him go next, but we'll just go to questions. Casey.
When Democrats tried to tackle health care, it was a long and very much not easy process, and it was led in the House by Nancy Pelosi, who did a very effective job wrangling her members and getting it done. Are you prepared to do the same thing?
I'm prepared to lead our conference to doing what we said we would do in the election. We actually ran on a repeal and replace plan. That's what this is, the repeal and replace plan we ran on. Now I am intent on making sure that we fulfill our promises, but I believe in regular order. I believe in going through the process the way it was meant to go through. We didn't write this bill in my office on Christmas Eve like they did in Harry Reid's office and then jam it through to an unsuspecting country. These committees are writing this legislation. These committees will be marking up the legislation tomorrow, and then it goes to the Budget Committee the next week, and then it goes to the Rules Committee on the floor the week after that, which is regular order. So I'm excited that we're doing this the right way. I'm excited we're doing this out in plain sight. Go to readthebill.gop. What I want to tell my fellow citizens is that the nightmare of Obamacare is about to end. That we are doing what we said we would do in this campaign, which is repeal and replace this awful law that is crashing. Let me say one more thing. Let's not forget, Obamacare is collapsing. Obamacare isn't staying. If we did nothing, the law would collapse and leave everybody without affordable health care. We are doing an act of mercy by repealing this law and replacing it with patient-centered health care reforms that we as conservatives have been arguing for and fighting for years. Chad.
Some conservative groups, obviously some members of the Freedom Caucus, are skeptical about this. A lot of this bill is steeped in your better way agenda, though. Are those criticisms a repudiation of what you crafted in a better way?
I don't think so. Let me just give you a list of what's in here that conservatives should be excited about. Number one, the bill repeals Obamacare. Number two, it repeals the Obamacare taxes, which is a massive tax relief for families for the cost of health care. It repeals the Obamacare spending, like the Medicaid expansion and Obamacare subsidies. It repeals the Obamacare mandates on individuals and businesses. It ends funding for Planned Parenthood and sends that money to community health centers. It has a Medicaid per capita block grant. That's the biggest entitlement reform anybody has seen here for decades. It nearly doubles the amount of money people can contribute to health savings accounts. That is a fundamental part and a crucial part of conservative health care policy. It equalizes the tax treatment of health care. I've been doing conservative health care reform for 20 years. For 20 years, we as conservatives have been arguing for equalizing the tax treatment of health care for all Americans so we can have a vibrant individual market so we have choice and competition. Look, there are two ways of fixing health care. Have the government run it and ration it and put price controls. That's what Obamacare does. That's what the left wants. Or do what conservatives have been arguing for years. Have a vibrant free market where people get to do what they want. They buy what they want. Equalize the tax treatment. Stop the discrimination in the tax code against people who want to go out in a free marketplace and buy the health care of their choosing. This does that. This lowers costs, creates competition, it allows choices. The most important thing that this thing does is it takes power out of Washington, takes power out of the bureaucracy and puts it back to doctors and patients where it belongs. Yeah.
I know you're waiting for the budget office score to come back, but by some estimates, 10 million people could lose their coverage. Is that acceptable to you?
Look, what matters is that we're lowering the cost of health care and giving people access to affordable health care plans. Look, the government will always win the war on government-run plans, saying if we mandate everybody buys what we say they have to buy, then the government will always estimate that they'll buy it. I just think that's bogus. That entire premise of that comparison doesn't work. The fact is, we're not going to have the government tell you what you must do, tell you what you must buy. We're going to allow the market to do that. We're going to let people decide what they want to do with their lives, and we want to lower costs by having more competition and equalizing the tax treatment of health care, having health savings accounts. That gives people the freedom to buy the plan they want and can afford. Yeah.
You have 218 votes for this plan.
We will have 218 votes. This is the beginning of the legislative process. We've got a few weeks. We'll have 218 when this thing comes to the floor. I can guarantee you that.
Mr. Speaker.
Yeah.
What do you say to
folks who say, they look at this bill and they say, this is just a big fat tax break for the rich.
Read the bill. Go to readthebill.gop. Yeah.
That this bill is just the first step, and Vice President Pence said that
Yeah.
he was open to negotiating on it. How open are you
Well,
to those kinds of
it's
conversations?
not that this is open for negotiations. What Mike is trying to describe is we envision 3 phases occurring here. So let me describe to you what the 3 phases are. Number 1 is this bill, which we use as reconciliation. As you all know, you can't filibuster a reconciliation bill. So this repeal and replace bill is what we pass through reconciliation. Phase 2, all the regulatory flexibility that the Secretary of HHS has to deregulate the marketplace, to lower the costs and stabilize the market. That's what Tom Price will do. There's something like 1,400 instances in this law that gives the Secretary discretion. Secretary Tom Price, unlike the Obama administration, will use that discretion to bring more market freedom and market stabilization. So that's phase 2. Phase 3 is to pass the bills that we want to pass that we cannot put in reconciliation because of those budget rules. What's an example of that? Interstate shopping across state lines. We love that policy. We think it's critical. But as you well know, you cannot put that in a budget reconciliation bill. Otherwise, it could be filibustered. We also believe in association health plans. Let people through their trade associations, farmers through the American Farm Bureau plan, restaurateurs through the National Restaurant Association plan, small businesses through the NFIB plan, bulk buy their health insurance in nationwide buying pools. We very much believe in that policy. But we know the rules don't allow us to put that in reconciliation. Medical liability reform. The practice of defensive medicine is cranking up healthcare costs, practicing defensive medicine, which makes healthcare ultimately more expensive for everybody. But we know we can't put that in reconciliation. Those phase 3 bills we're going to move also at the same time, and we're going to push those to the finish line. But those will ultimately take 60 votes in the Senate. So phase 1 is this repeal and replace bill. Phase 2, Tom Price deregulates the market and brings certainty so that we can have more choices and more plans and get the states back in the game of being able to regulate health care. Phase 3, pass those reforms that we believe in, that we think will make it even better, but we know we can't put in reconciliation because of the 60-vote threshold. Thank you very much, everybody. Appreciate it.
We will make America great again.